If you have pain or tenderness in front of the shoulder which worsens with overhead lifting or pulling, or pain or achiness in front of the shoulder that moves down into the upper arm, you may have biceps tendinopathy. This is inflammation of the long head of the biceps tendon. The biceps long head attaches from the lower arm bone in a location called the radial tuberosity. It runs through a narrow groove in the upper arm called the intertubercular groove and attaches to the shoulder blade in the area called the supraglenoid tubercle as well as fibrocartilage structure called the labrum. If you suspect that you have biceps tendinopathy, a medical practitioner may perform a speeds test. Let's take a look at how this test is performed. So this is the speeds test. We are going to make sure that the patient has no symptoms. Then we are going to palpate the biceps tendon in the bicipital groove. And then we are going to flex the patient's arm into 90 degrees. And we are going to ask the patient to hold this position while we apply a downwards force at the distal aspect of the radius and ulna. A positive test would be reproduction of pain or symptoms, but a negative test would be pain-free. So this is the speeds test. As you saw from the video, a biceps tendon is palpated while force is applied to their arm in a downward direction. The biceps tendon is placed under stress in this position, and a positive test would reproduce pain or symptoms in the front of the shoulder.